Hi everyone. I think we're live on yes, we are. Good morning and welcome to our first of several, I believe, live interactive sessions with Horizon Blue Cross Blue Shield. Um, this is intended to be a session for everyone to hold on, I'm sorry. Can everybody see me? I hope. Okay. Um, Intended to answer your questions about health insurance and health care coverage. And we are very, very pleased this morning to have Angelis Morel from Horizon Blue Cross Blue Shield. And my name is Maria Nieves. I'm the president and CEO of the Hudson County Chamber of Commerce. Oh, there we go. I think we can see. Woo,
Yes.
all right.
Great. Thank you.
Oh, I was a little concerned there. So welcome,
Thank you.
Argelis, and I hope I'm saying that correctly.
It's Argelis or Argelis. You can say RG. That's what typically people call me.
Got it. Excellent.
So, yeah.
Well, welcome, and welcome especially on a Saturday morning. Again, my name is Maria Nieves. I'm the president and CEO of the Hudson County Chamber of Commerce, and we are headquartered in Jersey City, New Jersey. Horizon Blue Cross Blue Shield is one of our members. So we're going to be answering questions with them this morning about healthcare coverage and insurance. You may know that now is the open enrollment period for healthcare insurance. So please, you can enter your questions into the chat box. We will be answering them during this session. And then when you enter a question into the chat box, if you would also please put in your email address, because we will be selecting one of our chat box questioners to win a gift card, a $25 gift card at the end of today's session. So why don't we just jump right in? Argelis, do you want to go ahead and introduce yourself really quickly? So everybody
Yes. Thank you for having me today. I know on a Saturday morning, but everything is virtual now, so it's kind of the same, right? Every day is kind of the same thing.
Yes, unfortunately.
I'm very happy to be here today and with you guys, of course, and your support of always making sure that we get information out to our community that's relevant to their current needs. So again, my name is Argelis Morel. You can say RG. I'm with Horizon Blue Cross Blue Shield of New Jersey. I'm one of the account managers on the individual and Hispanic markets for the state of New Jersey. We're comprised of a team of 5. And then an extension of that would be our Blue to You team. So we are very entrenched as field representatives into our community. We're out in the community. Unfortunately now, because of COVID, we're not able to be in front of members, but we are doing the best that we can via virtual appointments, via phone consultations. We do have some offsite locations that are still open by appointment. So we're trying to do our best to get folks, enrolled with our healthcare plans, and also for our renewing members to get more information, updated information for this year, as we've transitioned from a federal marketplace into a state-based marketplace for New Jersey.
Right. Excellent. So I think I will call you RG if that's okay.
Yes, that's fine. Yeah.
And we should let folks know that they can submit questions in the chat box in Spanish, in English, in some combination of the two. And again, please do enter your email address when you submit a question, so that if you are the winner of our $25 gift card, we can contact you after and find out how to send it to you through the mail. All right, so let's do this while we're waiting for folks to submit some questions. We're going to go ahead, and I've got some questions that were prepared, because there are a lot of common questions I'm sure that people out there have.
Absolutely.
That we can just dive right into. And so the first question is very, very basic, but probably the most critical. And that is, why do I need health insurance?
Right. Health insurance is definitely an essential part of life, right? Just like any other type of insurance, you assure yourself with life insurance or car insurance at the very basic level. Health insurance is equally as important. Why? During this pandemic, I think that notion of having healthcare has completely exacerbated to the point of there's a grand need to make sure that you have some type of health insurance. But overall, in the state of New Jersey, if you don't have any type of health insurance, there is penalties involved with that. So you do want to look at or speak to a representative that can help you with that process to understand what your insurance needs are, what is financially available for you. There's a lot of folks that don't know that they qualify for financial assistance through the state. And that's a big, misnomer that people just don't know. But the best way is really communicating with one of the reps. It doesn't hurt to ask these questions. Platforms like this today are great ways to ask these questions ahead of time so that you can know what options are available to you. I think the biggest part in all of this is really how much we educate our membership and folks who are out there looking for some type of healthcare insurance. We always start with education first, to make sure that they know what their options are financially, what their options are if they have a medical condition. There's different products for them. There's different plans. We have not just medical, we have dental, we have vision. So it's really important for them to be educated. And I think the first step is really asking those questions and getting educated in that, in those two categories, right? What is financially available, and what works best for me and my family in terms of our healthcare needs. And that is available to anyone really that's looking for that information.
Right. And, you wouldn't drive a car you can't drive a car. I mean, well, you could, but it wouldn't be legal to drive a car without car insurance. You really can't even register your car without car insurance. So you really, you should think of your health insurance in that same vein. So I think that analogy that you use is really a good one, as how people should think of it so critically. So when we say open enrollment, you can apply now. I guess, some people, they ask, when can I apply for health insurance? Is it just now during the open enrollment? How does that work?
Right. So open enrollment started November 1st. And it ends this year. There's an extension into January 31st for this month. We were actually trying to get folks enrolled by the end of December so they would have a 1/1 effective date. But now what will happen is folks will enroll this month and then they'll have a February 1 effective date on their policy. So, due to the changes, one of the good things about that is that it was extended another month. So it does give folks another month to actually look for any type of insurance in the marketplace, as well as renewing members kind of nail down what their options are for this 2020 policy moving forward. And as far as who qualifies, we're looking at folks that, are New Jersey residents, anyone obviously who lives in the state, is a citizen, is a U.S. resident, folks who have working permits. Those will also qualify for the marketplace insurance, and we can see if they can qualify for financial assistance as well. Folks who've lost their insurance through their job, folks who just, at this point had a baby, had some sort of change in their health insurance can now enroll during this time period. Outside of this time period, November 1st to January 31st, it's a special election period. So the only way that you can enroll is if you have a qualifying event, which would mean that you lost coverage through an employer, or you lost Medicaid benefits because your income was a little bit higher. You moved into the state, and you would have to present documentation within a time frame that states that. So really now is the time for folks to actually start looking at this information and get enrolled by January 31st.
Right. So the time frame was extended, obviously, because of the lockdown, the pandemic that we're having. Make sure everybody can get access to the information, because we're doing everything virtually now. So that the deadline is January 31st. And I guess I didn't understand this myself. So outside of that open enrollment period, I can only get healthcare or apply for it if I have a life event that happens.
A life event, yes.
Okay.
Exactly.
So if I were to lose my job, or say I lived in New York and I moved into New Jersey in June or something, and I
Yep.
didn't have a job, but I needed healthcare, then I could apply outside of the open enrollment period that now ends January 31st.
Exactly. Yep. If
That's very
you
good.
had a baby, you got married, you got divorced, any of those are also special
Right.
election.
I got divorced. I was covered under my husband's plan or spouse's plan, and now I'm not. Okay. Very good. I'm glad that, thank you for clarifying. I actually did not know that. So that's good for me to know. The next question we have here is about Obamacare and whether that's the same as the Affordable Care Act, which I'm sure some people still don't know if they're the same thing.
Right.
And then you also used the phrase marketplace.
Mhm.
Can you sort of explain all of this jargon?
Sure. I know it's a lot. We definitely use a lot of jargon and acronyms, but they're interchangeable, right? So Obamacare and the Affordable Care Act, which is ACA, are interchangeable. They just coined the name Obamacare because he was really the brain, I guess, the person behind enacting that law. The Affordable Care Act is, in fact, the law which states that you do have to have some sort of insurance. If not, then based on the state you live in, there's certain penalties or guidelines that you have to follow. With that said, the law was enacted back in 2010, I believe. I've been doing this for so long, I can't go back. But
I think that's right, 2010.
yes,
It's been 10 years.
yeah, but they're one and the same. I do get folks that'll say, "Well, I want to enroll in Obamacare," and I'm like, "Well, it's the Affordable Care," and then they get confused. But it is one and the same. And then the marketplace, what that means is that there's a marketplace through our state, right, where you can look up information on what carriers are available to you, what plans are available to you. This is really, if I can think of maybe like a grocery store or a supermarket where there's a, a, a variety of products and policies, right, that you can now look into and sort of decide whether which plan is best for you. Those plans are based on metal levels, right? So we start with bronze, then we go up to silver, and then we go up to gold. And that's really to give consumers kind of a wide range of what type of policy they're looking for. Because we have folks that are fairly healthy, need health insurance to make sure that they have something, right? God forbid anything happens to them. They want to make sure that they have some sort of health insurance. They want to look at their options. They may not gravitate towards a plan that may have very rich benefits. They may gravitate towards something that's a little bit more affordable in the pocket, right? So there's these wide range options that they can look for within that marketplace. And I think the best way is really, as I mentioned before, is speaking to a representative. If I could, we do have our 1-800 line where folks can actually call into, and they will speak to a representative that can guide them, that can say, hey, you do qualify, or hey, you do qualify for financial assistance. You're looking to see someone face to face, we can schedule an appointment with you. And that number is 888-765-7656. And you can contact us there, and we'll be more than happy to guide you through the process and give you a lot more information related to what it is specifically that the consumer is looking for.
Can you repeat that 800 number? And I also just texted Melissa Rosario, who's on our staff at the Chamber, to see if we can put that number as well in the chat box.
Sure. It's 888 765 7656.
7656. So I should think of the marketplace as my shopping center, if you will, for healthcare insurance.
Absolutely.
And today we're really talking about the individual purchaser,
Right.
buyer. And there are penalties if you don't have health insurance, and those penalties would kick in, I guess, when you file your taxes, all those types of things.
Absolutely.
Okay, so that's also important information to know, because as we were talking about earlier, like with the car insurance, you need to have it because there is a financial incentive to doing so, in addition to having the peace of mind that you've got the insurance for when you need it. Okay, so open enrollment we've talked about is until January 31st. I want to continue to repeat that during this broadcast so that nobody misses that date. Today is the 9th, so you've got about 22 days on the clock to get your health insurance squared away. So Horizon Blue Cross Blue Shield, I believe, is like New Jersey's number one. You're the largest provider.
Right.
And I want to just, talk a little bit about how you have become New Jersey's number one provider. Like, what are some of the things that really distinguish what you offer and provide?
Yes, we are the largest network in New Jersey. We have over 85 years now in the state of New Jersey. We are New Jersey. I mean, our membership, it goes far beyond, the individual marketplace. We have our state-based programs with Medicaid and Medicare, and we also have other programs for small group and larger group and national groups. But above all that, the access to care is really the key focus for us, right? Making sure that our membership have the access to care, whether it's their physicians, the hospitals, different medical centers, outpatient centers. We have over 80,000 providers and doctors in our network. And that's really important. And that's really one of the biggest pieces that I love to actually talk about, because, having the insurance is one thing, but then how to utilize it thereafter, right? And how to educate, again, our membership on, this is your network, and this is what you can access based on that, and what's available to you. But also utilizing that from a cost-effective perspective, right? Again, we have different policies, and we do have different price points, and within that, the member can really select which one works best for them. We do have online tools right now that are primarily, our main focus right now, to make sure that our membership is aware of what's happening. Specifically with COVID, we have COVID guides on our website, horizonblue.com. We also have other tools that are necessary for our membership. We have our member portal. We have our Horizon app. You can even get your digital ID card now. You don't even need the physical card anymore. And we're streamlining and updating all of this information quite quickly, just to really resonate with our members and make sure that they're getting all the access to care that they need, and they have all the tools available that they need in order to utilize that policy. Another big thing that I do love, and that this is really just for our team, right, Blue to You and the Hispanic team, is that we're out there in the community. We don't leave after open enrollment. We are in different locations throughout the state. And so we're always there to help our members. If they have questions related to their policy, if they have questions about enrollment, we're there for them. So that's one of the biggest pieces, is that we don't leave. We're constantly in the community. We're constantly available. And again, to find those locations, you can, again, call us to see where we are. I hope that after all of this, it's spring, summer, we can actually get back to doing some of our health fairs and coming out to some of the malls and some of our offsites. But we are, trying to get out there, and we are out there, kind of helping our members. And that's a big piece, again, because once you're enrolled in our policy, what do you do after? That's really the biggest piece, is folks still don't know. And we have folks that have been on employee coverage. We have small business owners who are new to the marketplace, and they've always had something kind of handed to them. And it's kind of like, here's a document, pick this policy, these are your benefits, and that's it. And now they have to learn what all of that means, right? What does the deductible mean? What does the out-of-pocket mean? What's covered? What's not? So a lot of that is just really a learning curve. And we want to ensure that our membership is aware of all of those key benefits that we provide, and all of those value-added services that we provide.
Yeah, and I'm glad that you mentioned the small business owner. Being that we run a chamber here in Hudson County, a lot of our members are small business owners. We're a small business at the chamber, so full disclosure, Horizon Blue Cross Blue Shield is our healthcare provider, And it was, yes, of course. You guys are, you provide some of the best coverage, and I do have my digital ID card. It actually took me a little while to figure out. It was a digital one. I could have it on my phone, the app, and I was like, oh, this is very different, but handy. And what it was very unusual. Like, it was unusual for me as the president CEO. I have to literally work with my agent to sit down and say, okay, what are all my options, and pick. And I think as small business owners, people who may, like me, have been employed by a big company previously, to transition into the person who actually picks the plan can be daunting and intimidating, because there is a lot of, different sort of things you need to know about deductibles and co-insurance. And so thank you for mentioning that, because I do think small business owners in particular need the extra assistance, if you will, to sort of navigate what they need to do for their employees. And some of them may be, in fact, instructing their employees to go to the marketplace themselves, and find their healthcare insurance that way. So this is really, really an important topic for all of them.
Absolutely. That's a good point that you made. Yes, a lot of them, the small business owners, are sending their employees, because under 50, you don't have to necessarily have a group policy. You can look at those options and see which one works best. You can, but if you don't want to, you can also move your employees into the marketplace. Absolutely. And that's a very good point, that a lot of folks don't still know. So
that's right. Yeah, and that's exactly why I wanted to point that out. We do have a healthcare plan at the chamber, but we're like 2 full-time employees. So if we ever wanted to, we could move into the marketplace. So I think people need to really understand that they have a good bit of options, essentially, available to them. I'm just going to go through some of our other questions. We're coming up on almost half, but I think this is a really good discussion. So in terms of that exchange that New Jersey provides, and so just so everybody knows, as you were explaining, it's Obamacare at the federal level, and then each state has basically their own marketplace that they manage. They pick providers who can provide health insurance in that marketplace. What do you have to do to qualify to then go onto the marketplace here in New Jersey to get health insurance?
Yes. So New Jersey was a federal-based marketplace, and now we're a state-based. So to your point, all that means is that New Jersey is taking kind of the reins of how the marketplace is managed, right? As a state level, which a lot of good things happen due to that, right? So we got an extension for folks into the month of January. There's also an additional savings from the state. So there is another piece of that. We get federal tax subsidies for folks who do qualify. And then on top of that, you can get up to $95 from the state as an additional savings, which is something that's really good for our membership. And the way to really understand if you qualify is all based on 2 things. The number of folks in the household and the income for that household. So if it's a family, if it's a husband and wife, it would be 2 folks in the household and whatever income they are reporting for the year. And that will determine whether they fall into qualifying for those tax credits or not qualifying for those tax credits. And the difference in that is, one is called on exchange, which is on the marketplace. The other is called off exchange, which is you don't qualify for tax credits and you're above that income threshold. But again, there's so within that income threshold, there's certain levels, and there's even more information aside from just getting the federal tax credit and the New Jersey tax credit. There's an additional savings called the cost sharing, and that's if you fall within a certain income guideline. So the best way is really to contact us so that we can right away let you know, yes, you do qualify. No, you don't, but we can still process the application. It's just a matter of how you're going to process the application. That's all. With the tax credits going through the marketplace, it's an additional 20 minutes. It's actually less this year, thankfully, to fill out the application. And, with off exchanges, it's a lot. It's probably like 15 minutes. So But we would know right away based on those two criteria, which is the number of folks in your household and your income level, and we can determine at that point whether you qualify or not. And again, if you're a US citizen, if you are a legal resident, if you have a working permit, you qualify for marketplace insurance. There's some folks that don't meet the Medicaid guideline for the 5 years of being in the state. If you don't meet that guideline and your income is low, because you would qualify for Medicaid, but because of that residency limit, you will qualify for the marketplace. So you still want to connect with us so that we can help you through that process.
Right. Yeah, and that's, I think, very important. Use the phone number, which we do now have in the chat box, the 888-765-7656, because the first thing you should do is just ask these questions and figure out what your options are. Get the process started and, start there. As intimidating as you might think it is, take the first step, which is making that phone call. And I had another question which just escaped me. Goodness. Oh, but you mentioned how quickly you can get the application in.
Yep.
And for anybody who was thinking about when Obamacare first came on to the scene 10 years ago, and it takes a long time and the websites break. That's not the case. I mean, it's been here now for 10 years. So the process is much better than what you may still be thinking about from 10 years ago. So don't let that be an obstacle to you either.
Yes, absolutely. And now that we've moved into, the state-based exchange with Get Covered, then it's a lot quicker this year. It's actually a blessing in disguise for us because we have folks that are looking for insurance, a lot more than in various other years. And it's a combination of what we're going through right now with COVID. Because, part of it is, although the testing, right, is covered and you can get that, but once you do contract it, right, so then what happens thereafter? And if you don't have health insurance, you're not going to be able to go visit a pulmonologist or your primary care physician to keep up with the care of what did happen or what transpired during that time. So that's really kind of what the driving force here. But I mean, health insurance is essential. It is not, a want, it's a need. You should have it. Again, we mentioned the penalties, but the penalties just go so far. I think people have now understood that truly this is essential to themselves and also for their family members.
Right, exactly. I think that's a good point to make about the penalties. It's only going to do so much. You have to have the realization that you need it. This is an essential thing that you need to have to protect your family and yourself. So you talked about COVID, and I know that's changed a lot of your processes for how you reach out to folks in our local communities. Can you talk about some of the community Zoom rooms that you have available, especially in the Hudson County area?
Absolutely. Yes. We've been trying to kind of, wrangle in how we were going to engage with our membership. And for us specifically, for my team and for Hispanic and Blue to You, we're constantly in front of our membership. So this was really hard for us as a team. We have this distinct rapport with our consumers and our members, and they always come back to us and they know that they can come see us. But this year has been completely different. So what we have been doing is a couple of things. So we've been doing virtual. If you go on our website and you click on Find Us or Contact Us, there's a section where you can do a virtual online meeting similar to what we're doing right now. Right. You can do a phone consultation as well and schedule that. But aside from that, we did offer the opportunity of having these community Zoom rooms. And we do have one, as you mentioned, in Hudson County. We do have another one in Passaic County. But the one that we have in Union City, it's at our offsite location, which is Save Latin America on 139 38th Street in Union City. And basically all it is you schedule an appointment. You can call us at the 888 number. We'll schedule you in for appointment. You come in. There's a specific room that you would walk into, and it's a huge monitor, And basically you would see myself or any other representative on the other side of the screen. We
Oh,
would
wow.
have a member
Okay.
and help them almost live, right? It's like a virtual live session. So they're communicating with us through that session. You know, they're asking their questions, they're doing their enrollments, or they're renewing members and they're renewing with us. But it's quite when we rolled it out, we actually were like, oh, we don't know how people are going to take this. But after you do the session, it almost feels like you are one-on-one with the person in front of you.
Right.
So you kind of like forget through the process as you're going along here. But it's a really cool concept that we came up with the help of, you know, Save Latin America, who is, you know, that is our offsite location. So we are typically there during open enrollment, Monday through Saturday. Right now we're there Monday through Friday on the virtual Zoom room from 10 to 3 o'clock. And again, you can call our 888 number, schedule an appointment, come in, and it's safe and secure. It's a room that has all, you know, COVID and safety guidelines. Everything is clean. You know, you come in, we do the session, everything is virtual, but you're talking to me kind of face to face in a sense, which is really relieving for our members and our current prospects.
Excellent.
Yeah. So, and then the other location is in Patterson, and that's at the NJCDC location.
Okay.
But again, you can always contact us. And that is also a good point, is when you contact us, if you do want to if you do want to attend one of the community Zoom rooms, or, you know, communicate with someone in a specific territory, you can let us know, hey, I live in, you know, Hackensack, and I want to talk to someone that lives around, that's within this area that's available. We can do that. Or, hey, I live in Hackensack, but I want to go to Union City.
Right.
We can make that happen as well. So,
okay, excellent. I love that idea. I mean, I think that's great that you have that, because if you don't, you know, we talk about the digital divide. I think it's important people have access to all the tools that we've had to start using, all of us. You know, it can be difficult. So thank you for doing that. I think that's wonderful that you have the Zoom rooms available.
And that was one of the reasons why we actually thought of the idea. There's a lot of folks that, you know, we don't even have Wi-Fi at home, don't know how to use Zoom, don't know how to download an application. I've you know, gone through the experience myself with my parents, where I have to show them, right, how to utilize a Zoom application or how to FaceTime. And so we have folks that are just underserved, they just do not have the accessibility to a device, let alone to Wi-Fi. And here's this location that they can come to that is safe, and that they can speak to someone and get all of their questions answered at that time.
Okay, very good. We have a question that has come in from, and I'm probably going to get this wrong, it's Jamilet Henriquez.
Mm-hmm.
And he's asking, how can he change his health insurance plan? That's something you can do right now, right? If that's what
you still have until you still have until the 31st of January to make those changes if you've already enrolled in something and now you definitely don't want to stay with that policy. You can make the change now. The best way is really to contact us at our 888 number. Jamilet, I see him here.
Yeah, he actually asked it in. I'm not sure if that's a man or a woman. Jamilet?
I don't know.
maybe a woman. The question was actually asked in Spanish, so I don't know if you want to answer it.
Yeah, I can answer it in Spanish too. So, sí, Yamile, puedes llamar al número que está en el chat, el 888-765-7656, para ver cómo le podemos ayudar sobre el cambio del plan de seguro, porque tiene hasta el 31 de enero para hacer esos cambios. I do see another question here. ¿Cómo me puedo inscribir? How can I enroll? Otra vez, si llamas al número del 888-765-7656, podemos ayudar a Maciel Rosario en cómo te puede inscribir. Otra vez, tomamos la información de su familia, igual el ingreso, y puedes llamar ahí. Tiene hasta el 31 de enero para inscribirse. Okay, I think, Jamilet, I answered their question. So excellent.
I want to, we're sort of over the half hour, but I want to ask about COVID, because I'm sure it's on everyone's mind. And New Jersey and the country have been having over the past week since the beginning of the year some of the worst days, like the highest case numbers, highest number of deaths. So the numbers just keep going up, unfortunately. And we've got the vaccine, which is a light of hope, and the rollout has begun. And I don't mean to put you all on the spot, but is Horizon providing information, or will you all be providing information to members about the vaccine as it becomes more widely available to larger portions of the population? And people will become eligible to get the vaccine, and how they
We're getting information as it's coming in, right, through our New Jersey state officials and CDC guidelines, and we have our chief medical officer who's really in line with everything that's happening from, in the beginning with testing and what's covered and what's not, and labs, and now moving into the vaccines. It's still kind of a work in progress. We're still updating a lot of that information as it's coming in. But if you do visit our website, horizonblue.com, the /COVID, or right on our website, there is information. There's like a big tickler that says, COVID information here. You can click on there and see all of the information related to COVID. And it does get updated as we get information coming in. But for the most part, everything is on there. We're following, CDC guidelines, state guidelines, and all of that good stuff. So that's really the best way of getting educated in that aspect with COVID and getting up-to-date information. We try to also send information out to membership via email so that they're aware of what's going on in relation to COVID, as we move forward. So, and it is kind of quickly moving as we're doing part of this enrollment, ending really for this month with enrollment.
Right. Yeah. I mean, thank you for that. I know all of it is a rapidly moving and very fluid situation, and there's lots of new information, and we're still learning so much about the virus. It seems that doctors and scientists are still learning so much. But I think it's good to know that there's a resource available to members. So, another reason to get health insurance, because now is definitely not a time, I think, to be without it. I don't think there's ever a time, but in particular with this health crisis that we're all, trying to survive, literally day to day.
Right.
It's very, very important. So we did have some questions. I'm going to pick a winner, but while I'm doing that, if you want to just any closing remarks, RG, that you want to share with folks, really impress upon them.
Sure. Okay. So, pretty much what we want to ensure is that people know that they have until the 31st of January to enroll. Please do not don't wait till the end. Call our number, which is our 888 number, 765-7656. Visit our website, horizonblue.com, to schedule your virtual appointments or phone consultations, whichever you choose. Ask the questions. Find out how you can qualify for any type of assistance if it's afforded to you based on that criteria. And I'm talking to folks that are, again, U.S. citizens, residents, have working permits. Our target market is, anyone that, right now we've had so many folks that are unemployed that think that they don't have insurance or they can't get anything. You guys definitely give us a call because you do qualify. Folks that have lost employee coverage and decided that, the only thing available to them was COBRA. Right. You can still look for insurance through the marketplace with us. So please give us a call. If you're self-employed, if you're a consultant, contract worker, self-employed, small business owner, all of you, this is specifically to you, a call out to you. You can give us a call. You do qualify, right? You want to know what you qualify for. Give us a call. We can guide you through the process. We can give you the best option for you and your family. And specifically, right, the salon owners, the beauticians, the truck drivers, those are all our members. Those are folks that we help enroll into the marketplace. And a lot of times they don't know that they qualify for assistance or that they qualify in general for getting individual insurance. So really, use this time to ask those questions. Don't be afraid. We don't charge for anything. Just call our number, because I get that too. People are like, oh, what's your fee? There's no fee. Give us a call. We can definitely be flexible if you want to see us at one of our community Zoom rooms, or if you'd rather just do a virtual consultation, we can do that as well. But don't miss that deadline, which is the 31st.
Right, exactly. And thank you for mentioning there's no fee to call the 888-765-7656 number just to start the conversation. There is one more question that came in.
Oh.
¿Cuáles son los planos que tienen?
¿Cuáles son los planes? So, Leticia, I have another one that says, ¿cuáles son los planes? Cubren medicamentos. So, do we cover medications, and what are our plans? So, tenemos varios planes que podemos educarla sobre cuál es la mejor opción para usted y su familia. So, y todo es en base a los niveles metales, bronceado, plata y el de oro. Y sobre los medicamentos, sí, todo está cubierto bajo la póliza médica. Los medicamentos, hospital, doctores, especialistas, terapias, todo está bajo el plan médico. Es un plan médico muy comprensivo que está alineado con lo que tiene que ver todo con la ley de the Affordable Care Act. So, just to translate that, our plans do, we have a variety of them. They're based on metallic tiers, based on the coverage that you need. And we do cover pharmacy benefits. We do cover, primary care, specialist visits, hospitals, therapies, everything related to a medical consultation or service is included in our medical policies. And aside from that, we have a dental and vision policy, which those aren't covered under the medical, but we do have those in addition.
Okay. And then, I was just thinking, because it's been reported widely, Americans are more anxious than ever and having anxiety and some depression. Your policies also cover mental health services. Because I think that's also really critical right now. And I don't know the data, so I'm speculating that within the Hispanic community, I'm Hispanic, so I'm just speculating about myself, that we don't sometimes take advantage of these services as well.
Absolutely. And it is
about mental health. And
that's a very good point. Yeah, I think we all need a little bit of care in that department, right? So absolutely, our plans do cover behavioral health and mental health. If you do need to see a therapist or a counselor, those are available as well, and that is part of the policy as well. So you do get to see those folks, and we have our network, and you can look through our Horizon Blue Doctor Finder to look up that information on there. But that is very critical, especially for right now. Yes.
Okay, and then there's just one more question. We'll take this last question and then give out our gift card. It's in Spanish. When you go to the hospital for an emergency, what is the cost, I guess?
Yes, what is the cost? So every, I'll say it in English first. So every service provided under the policy has a specific copay or percentage that you would have to cover as the member responsibility. Each plan is different, so we would have to look over the information based on the policy, so I can then, give you the exact number of what it is. So, en términos de la tarifa para el hospital o emergencia, todos los planes son diferentes y distintos en términos de los beneficios y cuál es su responsabilidad del pago. So, la mejor opción es llamándonos para que podamos revisar todos esos beneficios y también enviarle la información para que la tenga a mano para que pueda hacer su comparación.
All righty. And then can you just one last time, how do you qualify here in New Jersey really quickly?
Yeah.
That's the last question.
Yeah.
I'm losing my voice.
So qualifying for insurance for New Jersey is you have to be a New Jersey resident. You have to be a U.S. citizen, resident, or have a working permit. And at this point, it's open enrollment, so anyone can enroll at this time. All you have to do is give us a call, and if you fit that criteria, we can then discuss again, the number of household members and the income to determine whether you qualify for financial assistance.
Excellent. And there's one more question.
I see here, ¿cuáles son las ventajas en general del seguro? So basically, what are the benefits of being of having insurance, right? So we talked a little bit about this. Una de las mejores ventajas de tener seguro es que está asegurado en caso de una emergencia, que puedas tener. El seguro es esencial, ahora mismo es algo que necesitan tener, que necesitan educarse un poquito más. Si no tienen seguro para este año, la penalidad todavía sigue para el estado de New Jersey. Y la mejor forma de ver cuáles son sus opciones es llamándolo al 888-765-7656. So again, the most essential part of all of this is having insurance, making sure that you have it when you need it, obviously, and in case of an emergency, but everyone should have insurance. And the best way to really look at those options is by contacting us.
And then there is just one other question. What is minimum income to qualify?
So the income level is dependent, again, on number of household members and where you fall within that income. They call it an FPL level. So we have that guideline as far as income to determine whether you qualify for Marketplace. And sometimes folks qualify for Medicaid and they don't know either. But we can guide them and tell them, this is what you qualify for. You do qualify for financial assistance. The best way is really to connect with us and give us that information.
Okay, excellent.
Okay.
I keep saying we're going to do our last question. So you let me know when you're ready to, well, there is one more question.
Keep going, so it's okay.
All right, very good. It's Saturday after all, right?
Exactly.
Hasta que edad, my Spanish is not great, but I understand what you're saying. I just can't speak it. So that's the type of Hispanic I am. I'm sorry.
I do this English too, so I hear you.
But I can read it. I just don't pronounce it very well either.
Okay. I see here the question, Leticia. ¿Hasta qué edad un depende puede estar en mi póliza? That's a very good question. The question was until what age can a dependent be on your policy? The age is 26. That was part of the ACA. So, 26 years of age, they can still be on your policy. Leticia puede estar en la póliza un depende hasta la edad de 26 y después de eso entonces tiene que tener un seguro solo. At the age of 26, that's really the answer.
Yep, and that was a big benefit of the ACA Act, that dependents can stay on until 26. There was a gap. You leave college and maybe you didn't have a job, so your parents could keep you on their policy, which was great. All right, we do have a winner for our gift certificate, with $25 gift certificate. I did a run, so this is how we did it. I just did how many people entered a question on the chat box, and it's really easy on Google. You can Google random number generator, and you put in your number range. So we had 5 folks. So I put 1 to 5, and then Google gives me a number, and that number is associated to one of your names. So our winner, long story short, our winner is Jamilet. Jamilet? I don't know.
Yes.
I'm probably
Jamilet, yeah.
Yes. Okay. Enriquez. And if you are still watching and want to send us in the chat box your email address so we can contact you, or we know that you're on Facebook, so we can certainly reach you, I'm sure, via a message on Facebook to get in touch with you to send you the gift certificate, which we hope you will use to shop at a locally owned store. We're all about shopping local at the Hudson County Chamber of Commerce. I want to thank you so much, RG, for spending nearly an hour here today on a Saturday to discuss this really important topic and a lot of the services that Horizon Blue Cross Blue Shield is providing, including the ways to get in touch and start to ask questions. I'll just any last thing you want to say here to folks.
Yeah, likewise, thank you so much for having us, giving us this platform to talk to the folks, that you guys have, and as far as your membership, your audience, through your social platforms. I think this is a great partnership that we have with you guys, and again, being part of the community, making sure that our community is well educated and understand the services and the information that's available to them, especially in times like these, but in other times as well when things get better and we can get out there. As I mentioned, we are constantly in our communities and we're constantly, attending your events and being part of a lot of the great stuff that the chamber does. So thank you again for supporting us, and thank you again for giving us the platform today.
Oh, absolutely. Thank you. We can't really wait to see everybody live again at some point real soon. So again, the number to call if you have questions for Horizon Blue Cross Blue Shield about coverage is 888-765-7656. And you have until January 31st to enroll. So please go out and start the process. Thank you, everybody, for tuning in. We will be making this available to our members via email blast, and it will continue to be here, obviously, on our Facebook. So please feel free to share this with anybody you know who is also weighing these important questions about their healthcare coverage. Thank you so much, RG. Thank you to everybody at Horizon Blue Cross Blue Shield of New Jersey for providing these services, for being here in New Jersey, for being a partner to so many of us. Have a great day, everybody, and we hope to see you real soon. All righty, in person. All right, bye-bye.
Thank you.